Welcome to USMLEFasttrack.com. The section we're going to talk about today is from
First Aid for the USMLE Step 1, 2013 edition.
Page 437. What is the lower motor neuron lesion of the facial nerve called? The lower motor neuron lesion of the facial nerve is called facial nerve palsy. What is the consequence of facial nerve palsy? The consequence of facial nerve palsy is ipsilateral paralysis of upper and lower face. What is facial nerve palsy? Facial nerve palsy is a complete destruction of the facial nucleus itself or its branchial efferent fibers, like the facial nerve proper. What is the clinical presentation seen with facial nerve palsy? The clinical presentation of facial nerve palsy is peripheral ipsilateral facial paralysis with inability to close eye on the involved side, and this condition can occur idiopathically, and there is gradual recovery in most cases. Name some conditions that can lead to complication of facial nerve palsy. Facial nerve palsy is seen as a complication in AIDS, Lyme disease, herpes simplex, herpes zoster, sarcoidosis, tumors, and diabetes. What is facial nerve palsy called if the onset is idiopathic? If the onset of facial nerve palsy is idiopathic, it's called Bell's palsy. Briefly, describe what's happening in the picture of facial lesion. This picture here shows the facial nerve and where it goes and how it innervates the face. So we're going to first start off talking about it from where it says the face area of the motor cortex. Now from this, there you also see the cortical bulbar tract, and if the lesion occurs at this level where you see the first black line, the solid black line, so if the lesion occurs here, because the lesion is occurring before the facial nucleus, so if the lesion is at this level, it's called the upper motor neuron lesion, and this is the central facial palsy. Then you also see the facial nucleus, which has the upper and the lower division, and right underneath that you see the lower motor neuron lesion. So if the lesion occurs at this level, it's the lower motor neuron lesion, and this is called facial nerve palsy.
For more information on this topic, click on the link in the description section below. For a full USMLE Step 1 review, be sure to check us out at USMLEFasttrack.com, where we help you review the entire first aid for the USMLE Step 1 with high quality videos and hundreds of detailed pictures for a better understanding of the material. So to learn from the best USMLE review book, be sure to check us out at USMLEFasttrack.com.